Atropine. It is the prototypical muscarinic antagonist derived from the Belladonna plant. Life-saving drug in action. A 32-year-old farmer arrives gasping for breath after accidental organophosphate insecticide exposure. Saliva pours from his mouth. Pupils are pinpoint. Heart rate 34 beats per minute. Lungs filled with secretions. One drug is administered by the emergency physician. Within minutes, secretions dry up, heart rate rises, breathing eases, and the patient starts to stabilize. What is this life-saving drug? How can one medicine reverse so many dangerous symptoms at the same time? The answer is atropine, the prototypical muscarinic antagonist. Mechanism of action. Atropine is a competitive muscarinic receptor antagonist and prevents acetylcholine from acting on postganglionic parasympathetic effector organs. Let's see how this affects different organs. First, the heart. Atropine blocks M2 receptors on the SA node, removing the vagal inhibitory influence on the heart. This increases the firing rate of the SA node, producing an increased heart rate. Next are the glands. By blocking muscarinic receptors, atropine decreases salivary, sweat, and bronchial secretions. In smooth muscle, atropine relaxes the GI tract, bladder, and bronchioles by blocking parasympathetic stimulation. This decreases gastrointestinal motility, reduces bladder contraction, and produces mild bronchodilation. Finally, in the eye, blockade of muscarinic receptors causes mydriasis or pupil dilation, along with cycloplegia, which is paralysis of accommodation for near vision. Therapeutic uses. The first indication is bradycardia. Atropine is the first-line treatment for symptomatic low heart rate or AV block. By blocking M2 receptors in the heart, it removes vagal inhibition, allowing the SA node to fire faster and increasing the heart rate. This makes it a life-saving drug in emergency cardiac care. The second major use is as an antidote. Atropine reverses cholinergic crisis from organophosphate or nerve gas poisoning. It rapidly relieves excessive salivation, bronchial secretions, bronchospasm, and severe bradycardia by blocking the muscarinic effects of excess acetylcholine. The third indication is as a pre-anesthetic medication. Atropine reduces saliva and respiratory secretions to prevent airway obstruction during surgery. A dry airway improves visualization during intubation and decreases the risk of aspiration and perioperative complications. Finally, atropine has important applications in ophthalmology. It is used as eye drops to dilate pupils in inflammatory conditions like uveitis. Adverse effects. The important point to remember is that these side effects are predictable results of parasympathetic blockade. The common adverse effects include dry mouth, blurred vision, and photophobia. Dry mouth results from reduced salivary secretion, while blurred vision and photophobia occur because atropine causes mydriasis and cycloplegia, making it difficult to focus on near objects and increasing sensitivity to bright light. The systemic adverse effects include tachycardia, urinary retention, and constipation. Tachycardia occurs because blockade of cardiac M2 receptors removes vagal inhibition of the SA node. Relaxation of the bladder decreases detrusor contraction, leading to urinary retention. Similarly, reduced gastrointestinal motility slows intestinal transit, producing constipation. At high doses, atropine also produces CNS adverse effects such as confusion and hallucinations, particularly in older adults. Another characteristic finding is atropine flush, red, hot skin due to inhibited sweating. Key contraindications. The first and most important contraindication is narrow angle glaucoma. Here, atropine must be avoided entirely because it causes pupil dilation or mydriasis. In susceptible individuals, this can precipitate acute angle closure, leading to a sudden rise in intraocular pressure and risking permanent blindness if not treated immediately. The second is prostatic enlargement, also known as benign prostatic hyperplasia or BPH. In these patients, atropine should be used with caution. By causing bladder smooth muscle relaxation and reducing detrusor contraction, it significantly raises the risk of acute urinary retention, especially in elderly men who already have bladder outlet obstruction. A simple way to remember these two high-yield contraindications is the mnemonic. Blind men can't pee. Blind reminds you of glaucoma, while can't pee reminds you of BPH with urinary retention. Atropine at a glance. Atropine originates from the Belladonna plant and is the prototypical anticholinergic drug, making it the standard against which other anti-muscarinic drugs are compared. Its action is simple but important. It acts as a competitive muscarinic receptor blocker, preventing acetylcholine from producing parasympathetic effects. The key uses are bradycardia, where it increases the heart rate, organophosphate poisoning, where it reverses life-threatening muscarinic manifestations, pre-op to reduce salivary and respiratory secretions before anesthesia, and uveitis, where it produces mydriasis and cycloplegia while relieving painful ciliary muscle spasm. Finally, always remember when to avoid atropine. It is contraindicated in narrow angle glaucoma because pupil dilation can precipitate acute angle closure and should be avoided or used with extreme caution in prostatic enlargement where it can trigger acute urinary retention.